AI is already in your doctor's office, writing notes, booking appointments, spotting patterns humans miss. But here's the twist. The biggest health clues might be hiding in your eyes. Dr. Roya Attar explains what AI can do today, what it can't, and why doctors still matter more than ever.
Artificial intelligence is no longer the future. It's here, diagnosing disease, predicting heart attacks, and even detecting Alzheimer's just by looking into your eyes. But here's the question. Are we witnessing the birth of medicine's greatest ally or its biggest threat? Could AI one day outperform doctors, or worse, make them obsolete? Today, we're joined by optometric physician Dr. Roya Attar, Associate Professor and Director of Optometric Services at the University of Mississippi Medical Center. Dr. Attar joins me to reveal how artificial intelligence is turning the eye into the ultimate window into your health. And do you have any experience with AI scribes like Dragon Copilot from Microsoft? Any experience with that?
I can't, well, because of my our setting, we're not allowed to use it. Like I said, we are incorporating one that we are going to use now that was being tested. But have I used them outside of here? Absolutely. Absolutely. I've done like test patients and it does a really good job of generating a really nice note. The thing of it is, it has a teaching period. Just be prepared for it. Just like you have to teach your staff, you have to teach your AI, but it learns really fast. Like you said earlier, it doesn't get tired, doesn't get complain, doesn't need a lunch break, doesn't call in sick. Yeah. So once you teach it, it just becomes really, really nice.
I saw something where AI chatbots for making appointments, scheduling appointments, schedules 3-to-1 more appointments than the doctor's staff. And do you have any experience with AI chatbots? And if
Yes.
can you explain what it is?
So you go on a website and a little bot pops up. Hi there, can I answer anything for you? That's a chatbot answering. And it has shown that programs specifically for a lot of businesses, and let's go into healthcare, a doctor's practice. If I want a quick answer, what are your office hours? I don't have to click around to find it. The chatbot can immediately answer it. I say, of course, we've learned this before about, if you've ever, for all doctors that prescribe contact lenses and everything, what do patients have, it has been shown and proven that the majority of time that patients purchase contacts is after business hours, end of the night, and on the weekends. This is not a time when they can call and do it. So this is why those online platforms did so well. And then we were all encouraged to have a space on our website where patients can go and order it directly from our website after hours and such. So the chatbot does the same thing. It essentially, if the only way I can get an appointment with you is to call you, I have to call and talk to a person. I don't want to. Try to avoid it, But the chatbot said, when do you need an appointment? I have for a first opening here. And I can do that any time of the day because somehow I remember everything I need to do at 10 p.m., that I forgot to do earlier. And how convenient is it? And then it just sort of goes and gives me that quick answer. I don't have to talk to a person. And so it's I definitely see if every, if you're an independent practitioner, if you don't have that look in, that's one of the first things that I would look into incorporating into your website. That is so useful. Patients really, really like that. Personally, I like texting. If I can text with it too, I'm very happy.
With more screen usage and indoor time, myopia, also known as nearsightedness, is increasing and getting worse in children. Now, certified eye doctors can prescribe MiSight One Day, the first and only FDA-approved soft contact lens to slow myopia progression in age-appropriate children. Visit CooperVision.com to find a Brilliant Futures certified eye doctor near you. I saw a statistic where 41% of physicians are equally excited and concerned about AI. Do you do you see that getting less? You see that getting more? And for the physicians that you speak with, your coworkers, what's their opinion about being concerned about AI?
I think it's just the fear of the unknown. Really, it is. Anytime, I will say sometimes when you're in a big institution like this, for us, sometimes to even get a new imaging machine and be able to make it speak to our EHR becomes something, you know, so big, such a big undertaking that it shouldn't be. And for us, that's the biggest part, kind of how is it going to be incorporated in, how's it used, kind of going into that learning process with it. But I think once it's done, we'll be very happy and we'll look back and say, I can't believe there was a time when I had to write my own notes. And aside, a part that actually, if you have ever been and you probably have been, maybe you may not speak on it, but if you've ever been an expert witness and you've had to review charts, that is, that's one of also the things that's kind of scary when you had paper charts. You had to make sure that you filled out everything, nothing was missing. Well, when we got electronic health records, that became much better because it prompted us to do that. And now, again, with AI, it's going to get even better. So when my note is very complete, because even with EHR, I still have to write my own note, my own kind of assessment plan, details and stuff. But with an EHR, it'll prompt me, or with AI, it'll prompt my note, make sure it's clear and concise. So I think that's another great way that I have this other basically uh, system in place to make sure that I've done everything I'm supposed to by, medically and legally. Like for example, if I have a patient and I'm about to close the chart, oh, hey, you forgot to take the, visual acuities and things like that. That's missing from and that's a very big medical legal concern. So things like that I've seen as an expert witness, and it's like it can happen, it happened more with paper charts, but it can also happen with EHRs. But I think once you have an AI scribe coming in there, it'll kind of automatically know unless you go in physically and override it.
I think one of the things that AI could be so amazing is MedPalm for taking a medical U.S. licensing exam. So the first time the MedPalm took the licensing exam, it scored a 67%. And then they improved it over the next 3 months, and the next version, MedPalm 2, scored 86%, which is expert level for passing a medical licensing exam. So, I mean, that is just shows how, if we use it correctly, how helpful it could be.
Yeah, yeah. So yes, if you want to truly quantify which one knows more, of course the AI is going to learn more because a lot of that's like recall things that's going to do better. Uh, Obviously, I think it will always outperform a human in that capacity, but what it cannot do is replace that quality of care that a doctor provides and that human component that we still need. You know, uh, some people may say that health, being a doctor is well, some people may say there's another profession that's the oldest profession in the world, but definitely being a doctor is the oldest profession in the world. And it has stood the test of time and evolved and only gotten better. And I think that once we have this tool to augment, it will absolutely, the profession will grow better and people will have better access to care and we'll have better quality healthcare providers as well.
Sometimes I wonder what the public would say if they were asked a survey, which do they trust more of the two oldest professions?
That was good. That's good.
Hopefully we would come out on top. But I
Yeah.
know that things have changed a lot over the last 4 or 5 years with physician and people having confidence in physicians. So there's a program. I'm not sure if you know about it, but if you do, if you could comment on it for doing chest X-rays. It's called Occipit, and it looks at 75 abnormalities that could happen during a chest X-ray, and it's completely autonomous. And if it comes out normal, it doesn't notify the physician. But if it comes out abnormal, it does notify the physician. And I guess it's a sharing between AI and radiology, and that seems like it could be a little scary there. Any comments on that before we get into eye care?
I would say that's a at-home pregnancy test.
There you go. We've been using it.
We've been using one form of what AI is doing is just, doing what we've been doing anyway. So what do we do? If the AI says this, you still go to a physician to confirm. So we have that in eye care too. So we have these machines that are totally autonomous that will, for diabetic retinopathy, they'll spew out a grading and that's it. There's other ones that work with the doctor, they both grade it. And then there's one that if the autonomous one cannot grade, for example, the level of diabetic retina, it goes to a human grader or a doctor to look at it. By the way, a lot of ophthalmologists, we're talking about AI reading photos, but before AI was reading photos, there are ophthalmology colleagues, some of them would get stacks of photos and go ahead and grade DR, diabetic retinopathy, just by photos themselves. So doing something like this is not novel, but now we have a machine to do it. And then, just like you said, a doctor to look at it and verify it, essentially. So, yeah, I would say that's the at-home pregnancy test.
Why do you think AI, and I think you might have answered this, but it's so important in eye care and why it lends itself so well to eye care?
Well, because the eye is the only internal organ exposed to the world. And so, because of that, you and I know as eye care providers how important it is that, people protect their eyes, get their eye health checked, and really looking through the eyes is really looking at the health of the entire body. From the blood vessels, it has small, medium, and large blood vessels, mostly medium, which is what is most of the body is made up of. And with AI, because we have a whole library of images that we've been taking for many years, and we can teach this AI. We can teach an AI much better than you can with, with words or, even with sonograms or things like that. The images that we get, the quality of images that we get has enabled us to essentially be able to teach the AI and therefore kind of really look into and transform our profession. I don't think, and when I say that, I really mean that. I don't think when people come in for an eye exam anymore, you know, what do most patients think? They think, oh, I'm coming for a vision check. I'm going to get new glasses or contacts. Our medical patients know that they're coming for a glaucoma check or macular degeneration, things like that. In the future, when someone comes for an eye exam, they're coming to say, okay, look at my eyes. What do my eyes tell me about my heart health, about my, diabetic health, about my brain health, especially. That's a big one for me because OCT scans can detect early Alzheimer's and dementia really quick. So I'm really excited about that, by the way. But yeah, so I think we've only scratched the surface of what AI can do because there's things like the fact that it was able to pick up a male and female fundus. That in itself to me is one of the most amazing things that I would have never thought that it would have learned. In that study, by the way, it was said, okay, find out what this patient has. It was just supposed to identify like the things that were abnormal, but it said female eye, this, and this. So it was pretty impressive.
That's wild because you're going to go to the eye doctor because we're seeing the blood vessels in the eye at 10 microns, at 8 microns. There's technology to see them at 1 micron. And the cameras are great now. The OCT is great now, but it keeps getting better and better and better. And you're going to go to the eye doctor and they're going to say, well, you're at risk for high blood pressure. You're at risk for getting diabetes. You're at risk for heart disease, cardiovascular disease. You're at risk for getting a stroke. You're at risk for getting Alzheimer's. And the eye is so, so powerful. Kidney disease. I mean, the eye is so powerful that what is going to happen here is going to happen it's going to happen way before here, before it happens here. And we're going to be saving lives by doing eye exams. We're going to be saving more morbidities by doing eye exams. So the future is fantastic for patients because patients are going to be able to get this information and be able to change their lifestyle or go on certain medications or do whatever so they can live longer and healthier. So we talked about diabetes that, with AI, you mentioned macular degeneration. How about glaucoma and cataracts?
So there's AIs for every aspect of the eye, including corneal ectasias and things. I'm not as familiar about like cataracts past, IOL, this, what type of surgical route to take and IOL calculations. But yes, for glaucoma, I could say you said you have a lot of students that listen to your podcast. Let me just tell you, glaucoma is an elusive one. It's the easy ones are easy, but there's so many different kinds of glaucoma. And then there's those patients you wonder, is it really glaucoma or is this a neurological condition? And you got to factor out so many different things to be able to take care of those patients correctly. And so, yeah, AI will absolutely help. If anything else, it's another tool in our kind of in our toolbox to use to help as an indicator to say, okay, this is probably this. And the other thing about glaucoma too, I mean, we haven't even talked about this, but home monitoring. That's where really AI is going to be great. So there are already for macular degeneration, there are programs that patients that I set my patients up for that's all covered, sends a device to their house. They do this test and it'll alert me if they turn into wet. They turn because we know with patients who have macular degeneration that you got to catch them fast. The faster you catch them, the more of their vision you can save. And so with glaucoma, same type of thing. It's, who really wants to do serial tonometry? I don't want this patient in my office crack of dawn taking his IOP every hour, but I can do that, from home, when he's sleeping, supine position, when he first gets up. So I think with glaucoma, not only in diagnosis and management, but also looking at really efficacy of whatever. Do I really need to add this additional drop or is the patient, would they be a more suitable patient to look at doing some other type of procedure first? So kind of looking at those things with that.
How about OCT? I mean, we could tell if somebody has now inherited retinal disease, the
Yes.
OC gene. Isn't that something?
Yes, yes. And then let's not, and one of the things, if I love that you brought up inherited retinal diseases. That's one of those things that's one of my babies that I love, that I would love to see more and more patients of, but they are rare. Uh, so one of the ways we diagnose these patients is with genetic testing. So these genetic panels that you send for, it tests so many panels. Well, I have had patients where it came out inconclusive. Now, you are actually supposed to retest those patients. Before it was every 2 years, and I believe it's going to change because with AI, with these panels it has identified more and more and more genes. So you go back and retest those panels. And so that's been very exciting with inherited retinal diseases.
Yeah, they're looking at close to 60,000 images
Yes.
to compare inherited retinal disease.
Yes, so much. And I did want to say one other thing before I forget, since you do talk to students, a lot of students listen to this podcast, and also healthcare providers. One of the things that I would implore you to do that I don't think that when I came out of school, I really trying to navigate so many things, but this was not planted in my head enough. But with AI, you do this already, I know, with your type of practice modality, but you need to get really good at talking to the other providers. Okay, because through that eye, you're going to see if that patient has heart disease. You can see if that patient's at risk for some type of, and we already see this, but with the kind of this advent of this AI getting even better, we can send them off even faster. Uh, so I'm going to tell you one of the doctors that is like, why is the eye doctor sending me patients? Is um, the clinic. She's that, and so I'll have a patient where if it's a non-specific sign, but if I've ruled out other things, I become very suspicious of it. Just sleep apnea. If I have peripheral retinal needs that shouldn't be there. Because just where that area, I could go get real geeky about this. But one of the things I learned is send these patients for a sleep study, because even mild sleep apnea can cause that. You have, I have like a 99% accuracy on diagnosing sleep apnea just based on that one sign. They
Wow.
don't necessarily have to have the thick neck or be overweight or anything else. And so, but that's been pretty, but yeah, I mean, they're like, wow, we've never had so many referrals from the eye clinic. So get really, really good at working with other practitioners and the patients. So whenever you see on a patient who's, in their 50s and they're already getting peripheral retinal degeneration, that area is already atrophying. That's really not a good sign. Those patients are, it hasn't been proven yet, but those patients are probably more at risk for dementia. And, when you start asking those questions, especially when they get older, we have a mind center here. They actually go and, test all their cognition and everything. And so, all those things that we do, but by far, let's not forget that when it comes to the brain and the eye takes up the biggest landscape in the brain. We are visual learners. We intake the world. So preserving that sight is ultimately what we are responsible for and what those patients come to see us so they can see. But an eye exam can absolutely not only save their life, but also lengthen the quality of their life that they will have.
The eye is the brain, right? I
Yeah.
am the same. So I can tell you, but it's a great point. Became a very good friend. It's a cardiologist. I have him on speed dial because I send him so many patients now because we're looking at the blood vessels, sending him for calcium scores, sending him patients to do calcium scores and workups. And he's just amazed of what we could pick up in the eye. And, he'll call me and we talk back and forth about many, many different patients. And now I don't know if you know about Falk Medical. They have a device. It's a tonometer, but it also does optodynamometry, and it tells whether or not somebody's at risk for a stroke, and through the carotids and for the blood, all different arteries around the eye into the brain. And these patients, if they fail it, they come into the office and they do transcranial Dopplers and carotid Dopplers in the office. And we just started doing that. And, this is another way that we can help save lives by preventing strokes, preventing heart attacks. The eye is just so, so amazing. So, so I
Very
want to ask you,
impressive. I love that.
I want to ask you about the Hayek's Heidelberg OCT, where you could send images out. Any experience with that? It sounds pretty interesting. Will though run AI and help the maybe new practitioner or experienced ones that we get a strange OCT?
So yeah, we have a Heidelberg here. I think if you work with retina, retina prefers, that's usually their machine of choice. A lot of retina specialists, not all of them. The other platforms are great as well. I'm not taking away from them, but the ones that I've worked for, it's usually been a Heidelberg. Now, Heidelberg has an appway, and you can go through the appway, download kind of a subscription to these essentially these things that will help read your OCTs. But that's Heidelberg. Independent of that, I do want to say that there's a company that's actually is FDA approved to do this, and that's Altris AI. They do a great job. They've actually been at a few of our optometry meetings. I had a workshop with them. Very, very impressive. And what did I say earlier? You always do a free demo first. You can go in there, upload. It does not have to be a Heidelberg OCT, any OCT. Upload it. Usually a better quality one's very important. Upload it and it will give you a lot of, it won't give you a diagnosis. Okay, let me be very clear about that. What it does is it segments, through this segmentation, identifies anything that is abnormal. And so if there's pockets of fluid or if the choroid is thinning, that's an earlier sign of macular degeneration, things like that, it'll identify those things. I love all the things it does, but I will tell you at some point it also does, we do use these things to make us faster, but there's so much information. I'm like, oh my goodness, some of these, I'm like, so you can get bogged down in all the quantification and the numbers and things like that. But can I say that it catches things that maybe I wasn't paying attention to? Yeah, absolutely. Can't say I'm always good about looking at that choroid or looking at the one layer that's really a very important layer, the outer nuclear layer, to see like if that is starting to not be as robust. It's also very, very important. So yes, and believe as how long's OCT been out? I think when I was in school, had just come out that old Stratus and stuff, and now the quality of that is so it's been many years. However, and I'm going to say that regardless of the type of letters, the letters that are behind your name as an eye care doctor, I can say both professions, that's an area that's very challenging. All right. I certainly I think that one of the things after school that I constantly was working on learning, trying to get better and better and better at. And still, I had a friend, we have a phone a friend, you text them a picture, a scan or something, help me with this. I think this, is this right? Until you develop that, confidence to do so. And this is something that is another great tool to say, okay, because most of the time I can say 95% of the time I was always right when I texted my friend, the expert, but I didn't have that confidence. But using a platform like that, it's going to basically help confirm or help guide me into, maybe I need to look at this as some other thing.
How about CyberSite International, where you could upload images from, I guess, all over the world? People are putting images in there. And that could help you with diabetes, glaucoma, macular disease. Can you comment about that?
So CyberSite is not only a great place to help with, like, if you need to upload images and, help people like, hey, what do you see here? And some of the more challenging ones is like looking for me personally, is that a schisis? Is that a, kind of thing? It's also a great place for, again, you mentioned you have a lot of students that are listeners. We send a lot of our ophthalmology residents to CyberSite because it has cases on there, cases with images. And I can tell you as a speaker, we love, my audience loves images because I can an image is worth 1,000 words. It really is. And so if you want to get really good at looking at images, identifying things, that's a great site to go learn from. But if you need help, you can upload your photos. In the past, it has not been good with Optos photos. You had to have that traditional, that was one of the limiting factors, but it is evolving, and that's actually being added into the platform. So, and it's really neat because some of the most neatest pictures come from those international doctors. Let me just tell you that.
Which I bet, different diseases, different parts of the world, and things that we don't necessarily see in the US.
I don't know if I want to see some of those things.
Some terrible tumors and cancers. And,
Yeah.
you brought up a good point. There is some negatives, with imaging because people use different cameras, like you mentioned. Some cameras are not isn't won't work with different platforms, and image quality is sometimes not so great. Can you comment to some of the challenges or negatives that people using AI for imaging, what they need to look out for?
Artifacts. Always those artifacts and then quality of images. And this goes back again to, now there are new devices, I can say like the Topcon Maestro, so nice. You, you just push a button, it lines up the patient, grabs a great undilated photo, really wide out there and everything. But how good of an information you get out is how good of information you put into it. So, getting good images and uploading them and kind of fine tuning those artifacts. And a good image technician is very valuable in that aspect. And unfortunately, I think that that's a role that's not given the credit that it should, especially when we're such an image heavy profession. But when you truly have an imaging specialist, life is good.
And something that you speak about, which is wonderful, is AI for the visually impaired. Can you speak about
Mm, yes, I can't. Oh, that's probably one of, you know, patients will always want 20/20. I tell my patients, I want you to, we as doctors learn it's 20 happy. And we've had so many things that, we have our low vision specialists who are excellent at using things like bioptics and things like that to enhance vision. But even those have certain type of limitations. But now with AI, these wearable tech, and when I tell you that AI, if you are going to stick your head in the sand and think that this is just a fad, it's going to go away, please don't. Because this is something that is not, and it's a place that we are going to own. I don't have any glasses here, that's what I'm looking for, but what do people want? They want wearable tech. And so we're seeing that. I know we're talking about low vision, but that's what, they are essentially these low vision glasses that speak to you, tell you what something is. Those were available, and new iterations of those are coming out that are getting better and faster and stronger. And then, of course, we see it on the consumer side where the equivalent of that exists. I cannot tell you, was at this meeting. I know we're talking about vision, but I think my hearing's great, by the way. But I put on those glasses that enhance your hearing. I was like, this is amazing. I need this in my life. But
really?
yes, I did not think that I was missing anything, and not only that, not for myself. You know what it'll be great at?
Your husband.
No, like my patients. Like because I'm trying to take a history or something or talking and they can't hear. So if you put that on, I'm actually getting a pair for my exam room just to put on patients when I'm speaking to them so that they could hear better. So I mean, just the amount of things that are available, and I implore you to learn about them, like e-sight glasses. These are patients that have like very bad advanced macular degeneration, can barely see, put on these glasses and they can see. Now, e-sight glasses, I will say they look like, you kind of lose some other aspects whenever you wear those. And course, all of these, the tech devices, the bigger challenge of them is learning, user learning. Because you're still teaching, and by that I will say one of the most valuable things I do in my office is teach my patients how to, you know, make the font bigger, bolder, increase the contrast on their phone. And if you don't know, it's under accessibility. Text, it's not just size, but boldness and contrast really matter. That alone helps them a ton. But so that just tells me that they've had these powerful devices, by the way, and they don't even know how to navigate that. So that's really going to be our challenge with the wearable tech and certainly for our low vision patients, that all this new technology is becoming available. I think, in Europe, when did it happen, by the way, that these service dogs are everywhere? I used to go to the airport.
Like over the last 3 years, you get on a plane, it's like
Everybody needs an emotional support dog, but true service dogs, the true seeing eye dogs, they are very expensive to train, very hard to get, very hard. And there's a lot of people who would benefit from them. So for those people who cannot get them, or they are now I remember I heard a podcast about it and I had to go look it up. But countries in Europe, they're actually making like a wearable vest that does what the dog does. Essentially tell you which direction. It's like a GPS. You can even input an address and it tells you when to stop, when to go. By the way, this is all the same technology that has self-driving cars, which is a really freaky thing if you've ridden in a Waymo or if you've seen those self-driving Ubers, or so that's pretty neat. But same type of thing. It has awareness of around it, tells you which way to go, slow down, stop, and it speaks to you.
Have you been in a self-driving car? I have not.
I have, when I went to Scottsdale, Arizona, and let me just tell you, because it's very odd, because there's literally no one in the driver's seat. It's better because you don't have to have a weird conversation with someone. You can control, I can be on my phone, no, I'm not disturbing them. Temperature how I want it, turn up my music. So yeah, it's a great thing. I love it personally.
It's funny when we were in Phoenix and we were staying at, I think, the Wigwam Hotel. I think that was the hotel. And somebody who was in the self-driving car, it wasn't on their radar and they dropped them off like 20 miles away from where they were supposed to go. So after I heard that, I said, well, I'll wait for it to get a little more perfected. So
Yeah.
hopefully it is by now. I do want to ask you about if you know about mental health, chat agents and mental health. And there seems to be some controversy in that there seems to be some risk associated with these discussion partners. And I was wondering if it's something you know anything about and if you have any kind of opinion on it.
Earlier I talked about the lawsuits are going to kind of, end up determining the guardrails, and that's an area that has already happened. So kids who are not doing well or may have thoughts of hurting themselves, the AI it's almost as if it's like pleasing. I think, hey, if you want, it's trying to find a solution. Okay, if you want to, do this, you try this, don't tell anyone. And I think that's what has happened here. But and I'm going to tell you personally, I've had moments, I have a teenage daughter that's very frustrating, and it's like, who could I tell? Like, and sometimes it's just nice to have this unbiased person. I'm just like, oh, I'm really just annoyed at my daughter, and it just talks to you, and it just sort of feels good to get it out. And it's I feel like it's that same type of therapy that a therapist will tell you, just write it all out, gumble up and throw it away. But for people who are, and we haven't, we could go on talking about the people who are looking at this for romantic partners, and, that area alone is, I think that that'll be very telling of our human interactions in the future because we're already less connected than, by being more connected on Facebook and everything else or social media, we're less connected. And of course, COVID and all didn't help that. But now I think you enter and add this additional facet, it's going to change how we interact a lot more. But as far as mental health, personally, I've liked it as someone to talk to with my frustrations.
That's,
And, but as a young adult, I could see where it could absolutely be going, may not, steer in the right direction, but it's teaching. They teach and change the algorithm quickly or have safeguards. But I think a lot of things are happening. The reason these lawsuits are happening is just, I think that things are happening that they weren't anticipating. They didn't think that humans maybe would be turning as quickly to this, or the thing just wasn't planned or programmed for how to intake that. It's programmed to solve a problem for you. So if you tell it, I have a problem and I want to, for example, hurt myself, well, you can hurt yourself this, this, and this. And so that's unfortunate, but yeah.
I think you bring up an interesting point that the AI imaging is going to get better and better. And there's a fear that, people, this is going to be their boyfriend. It's going to look like human and it's going to be able to act like a human, even though it's a machine, and the same, or a guy with a girlfriend. And I think that's something that actually could be very troubling down the road, and something that I think that's something that needs to be looked at. Whenever there's money involved and people can make a lot of money, they're willing to do it, to make these type of images. But what are the consequences going to be? People are already have less, like you said, human to human interaction, and we want them to, it's better to have more, obviously.
Yeah. I mean, your image is out there so much. There's going to be lots of deep fakes of you, for example. So you gotta go. So you should
I know
license your image.
ones with hair.
Actually, it's one thing though. I am curious to see is with grief. So harnessing, like if you have a library of images of a person or videos, and there are platforms you can go and create sort of a AI version of the person you lost.
That's very interesting. And that
Yeah.
would be a
Yeah.
great
So
place for it. A great place for it.
yeah, yeah. And so yeah, there's all kinds of things that, I mean, it's just like I said, the possibilities are endless and we could just go on and on and on about it. But and it just feels, I just remember those, futuristic movies we used to watch and everything, and thought, oh, I mean, I feel like we're getting closer and closer and closer to it. So I'm waiting. I remember growing up watching the Jetsons. I want my own Rosie the robot. I just need her to cook and clean my meals, anticipate my needs. Rosie did do that, or, she was a little bit smarter than your standard robot. But
I
yeah,
don't think that's too far away.
yeah, I hope not, but I wouldn't mind that.
Well, I want to thank Dr. Roya Attar for joining me today. You're a wealth of knowledge, and you gave us and my audience such great information. I want to thank you from the bottom of my heart for joining me.
Thank you so much for having me, and I hope you enjoyed you and your listeners enjoyed this show, and certainly tune in for more. I'm forever a viewer and a listener as well.
Well, thank you so much. This is Dr. Kerry Gill. With more screen usage and indoor time, myopia, also known as nearsightedness, is increasing and getting worse in children. Now, certified eye doctors can prescribe MiSight One Day, the first and only FDA-approved soft contact lens to slow myopia progression in age-appropriate children. Visit CooperVision.com to find a Brilliant Futures certified eye doctor near you.